We move on to our next talk of today, need for sustainable eye banking in the face of tissue constraints. Eric, your turn.
Thank you. Okay, thank you for giving me the opportunity to talk today. Last time I was here about a year ago, I believe, we talked a little bit about some of the things that Eversight had done in response to COVID, but this is a little bit more focused on some of the issues that we've come up because of tissue scarcity with COVID. We like to start every one of our presentations with our mission statement, which is we restore sight and prevent blindness through the healing power of donation, transplantation, and research. So the gift of sight being a public health priority. Eversight is one of the largest nonprofit eye banks in the world, and you can see that while we have a significant global impact, there's still a lot more blue than there is orange on this map. So the orange pins are where we actually place tissue, and the blue is in areas that still are underserved. And this is sort of the problem, is that we're looking at one country trying to provide tissue to a large audience in the face of about 10 million corneally blind, and in these things like the pandemic have caused issues and constraints on that. Back that up, you can see the EBAA statistical reports. Now you can see right before the pandemic, everything's humming along just fine. We're seeing significant growth across the board. But then the pandemic hit, and you'll notice that the gray bar, which is surgeries that are performed in the United States from US tissue, while lower, is not nearly as low as in variance is the red bar, which is the tissues that are performed outside of the US from tissues that are recovered in the US. Put a number to that, we're just under about 30,000 per year prior to the pandemic from US recovered corneas. And then the next year, that number dipped down to almost half with just over 15,000. The numbers are recovering, and the unpublished 2021 data does show there's recovery, but still the recovery rate while in the United States for tissue that's staying in the US is very similar to what it was before. Now the tissue that's going outside of the US is still significantly hampered and is not recovering at the same rate. So this again underlines the importance of, or it underlines the problem that US eye bank cannot be a source of tissues for the world. Again, 30,000 corneas a year versus 10 million corneally blind. So we talk about the global cornea health blindness problem. So millions of people around the world suffer, like I said, roughly about 10 million. It is the leading cause of preventable blindness. 90%, a hugely disproportionate amount, are affected by lower income countries and with a wide variety of infectious and non-infectious diseases. Capacity needs to be built because, again, this is not sustainable. 53% of the world has absolutely no access to corneal transplants, and very few countries are self-sufficient. Fewer still are in the position to be able to actually export tissue to help around the world. So we're really talking about importation as a short-term solution, and it's really even only to the fortunate few that are capable of finding an importation source. This eye banking infrastructure is lacking in most countries, and that's one of the biggest problems when you look at it. Substantial untreated corneal blindness throughout the world. I mean, I think that's sort of an understatement when we look at this. And it's the most vulnerable are disproportionately affected. I mean, we're looking at areas that need it the most are also the ones that don't have the means to provide it. The corneas are really, in most of these places, the barrier. The surgeons are trained well enough to be able to at least offset some of the vision loss if they had proper tissue, but they just don't have access to it. So really effective eye banking systems are the only way to make corneas available in curing global blindness. So as I said before, we've had a significant supply issue when it comes to COVID, but COVID's really only part of the story. Like I said, we saw a decreased donor pool because of risk assessment, screening possibilities. There's additionally increased barriers to entry in different countries. So a lot of countries, when they saw COVID, they started, through a lack of understanding of how the process really worked from all over the world, they started shutting down different entry parts. So with things like would require COVID testing or other risk assessments that were not there before. So even if the tissue was available, there were some there were some processes put in place by the country that were preventing the tissue from even getting to the end user. Life expectancy is another significant issue. So you can see in 1992, and as a statement here, a lot of the eye banks in the United States have a cutoff age limit of about 75. Well, back in 92, that average life expectancy was right there. So the population was, more of the population was falling into that. As medicine is getting better, we're starting to see that as right now, it's more like 79 years old. So the average life expectancy puts the average death to be outside of the 75 and under category. Now, other eye banks are increasing this to try and get more tissue supply, but there's sort of a mixed bag as to where is the age limit, where's the break off, where we're starting to see a declination in tissue quality and suitability. Projected estimates have in 30 years that number will actually reach to almost 84 years old, which would put them well outside of just about everyone's recovery zone. So the other problem is that even countries, that there are some countries out there that through importation and have the means financially to sustain their programs in their country, they're now finding issues with limited supply. So even places that have resolved this issue locally are now finding themselves in a position where they can't readily get the tissue as easily as they could before. One of the other huge problems that's happened is that, as I spoke before, areas that are underserved are disproportionately also the areas that are in lower economic status. Well, this pandemic with the decrease in tissue, and not only that, but cost in shipping has increased. The cost in shipping has not only increased to get the product to the end user, get the corneas to the end user, but it's also the equipment necessary for the eye banks to do the recovery. So all of these little incremental costs are increasing the price of tissue. Additionally, flights are not as readily available. We're seeing significantly more delays in shipping from all sorts of sources: airlines, FedEx, DHL, UPS. We're all seeing increased delays and an inability to get tissue into places the way that we had before. So with fewer available tissues, the lower fee outlets, the places that are underwritten by full fee outlets in other areas, are now finding themselves in a more desperate need than they were before. And this is a significant problem. It's basically the increased costs are basically getting to the point that they're pricing out all of these underserved markets, people that need it the most. So the question is, what do we do about it? Well, self-sustaining eye banking is the only long-term solution. There's really no way that we're going to ever get importation as a means to help out. The advantages that we have here, though, are that there are more cultures that are accepting of donation now than there ever have been. Work with organizations like MOTEP in the United States have increased minority donations to the same basic levels that we're seeing with other cultures. Muslim culture increase has been really accepted in the last 5 years, so that's a significant advantage considering how large the population of the Muslim world is in the world. Realistically, we've got to be prepared because you never know what's going to hit next. Could be another pandemic, could be something else that we have no idea about. 3 years ago, not a person on this panel, I think, really thought that a pandemic of this nature could even exist in these times, much less shut us down in the ways that it has. Thankfully, we're recovering, but I think it's really taught us a lot of lessons. And the development project can be very, very lengthy, so it's never too soon to start. The other advantage that we really have in this day and age is that the social media campaigns are better than they have ever been. And the concept of social responsibility is at an all-time high with current generations of people thinking in general around the world. So really, sustaining in your country is one thing. Sustaining in your city is great. Sustaining in the country is better. We need to look at regional and even global sustainability. And this means that collaboration across everyone. Not one person can do this. So we really need to get together and think through how we're going to pull this out. Integrate and align eye bank development to have sustainable goals. Sustainability is really the key to all of this. We can't just go in there, start something, and then have it fall away. We need champions and leaders that are going to really push us forward and not drop the ball and make sure that it gets moving forward in every way. And then we need studies and codification of best practices for designing, implementing donation programs, specifically with cultural context. And the example that we have as an organization is our focus on the Muslim communities, the efforts we've put in to try and increase the donation in that area. With that, I thank you very much for allowing me to speak on this topic, and there's my email. You can always contact me if anything, and I encourage anyone to reach out if they have any questions or thoughts.
Thank you, Eric. That